Hello everyone, welcome to physioBRAIN. This is Professor Adriano, and today we will be talking about 6 signs that may be present in children with pneumonia. These signs can also be seen in adults, but especially in children, because we are now entering winter, right? And pneumonia tends to be more common during this period. So stay with us, because we're going to talk about this today. And don't forget to subscribe to the channel, like the video, and share it with anyone who needs this information. So everyone, now that we're getting closer to winter, respiratory illnesses become more pronounced, right? We can see that pneumonia is one of the main causes of death in childhood, right? It is estimated that approximately 2,000 children die every day from pneumonia worldwide, right? That amounts to almost 1 million child deaths per year around the world, right? So this has economic repercussions as well as health impacts, which highlight a great need for information on this topic, okay? So we are going to talk about 6 signs that may be present in children who have pneumonia. The first sign is coughing. It is very common to notice that children develop a faster, more frequent cough when they have pneumonia or are about to develop pneumonia, often already showing some respiratory symptoms, right? What is normal? We cough a few times during the day to clear out fluids, the mucus that is normally produced in our lungs. But what happens with these children? For some reason, they are producing more than normal, so they are going to cough more than usual. So let's pay attention. If the child is coughing more than normal, and especially if the cough is productive, if they're bringing up phlegm, if there is mucus, right? If this is present in the child, it is a warning sign. Let's stay alert, because one of the signs is coughing, especially a productive cough. The second sign we can look for, not necessarily in the order they appear, but these are signs that complement each other, is fever. It's very common for children, due to a respiratory process, to develop a fever, right? Fever is a natural response of the body to some process of inflammation or infection. So if our child already has a cough, is showing a cough and also has a fever, especially if it goes above 37.5, 38 degrees or higher, let's stay alert, okay? Cough and fever together are signs that the child may have some respiratory condition that is affecting their health at this moment. So let's pay attention to this symptom. Our third symptom is chest pain. It's very common for children to feel sore in the chest area, right? So if the child is experiencing pain, if the child doesn't speak yet, right? But when you handle the child, when you pick them up, put them in the crib, or lay them on the bed, they show signs of pain, they make expressions of discomfort, right? Or if the child is very, tearful, crying more than usual, it could be a sign that they have chest pain, right? Pain in the chest. And this can also be a sign of pneumonia, so let's pay attention to this sign as well. Fourth sign, general malaise. If the child is showing, excessive sleepiness, if they're having trouble eating, refusing food, refusing to nurse, right? They're extremely drowsy, irritable, right? A general malaise can also indicate an infectious process, an inflammatory process originating in the lungs. So let's pay attention to these signs that the child may be showing. And the fifth sign, and one of the main ones, is shortness of breath, right? So the child may become more breathless, may have difficulty breathing. And when it comes to shortness of breath, we can and need to observe and identify a few things. The first is the respiratory rate. If the child's respiratory rate increases a lot, if they are taking in air much more often than normal, it could be a sign of respiratory distress, right? For this, we need to know that a child from 0 to 2 months old, a newborn, breathes about 60 times per minute, right? So they basically take a breath in and out, right? Almost once every second, right? So every second she's taking a breath 60 times in a minute. So if they're breathing much more than that, If you notice that their breathing is very rapid, it could be a sign that they're tachypneic, right? Showing a sign of respiratory distress. So let's pay attention to how many times they breathe in a minute, okay? So from 0 to 2 months, it's 60 breaths per minute. From 2 months to 11 months, about a year, it's common for the child to breathe up to 50 times per minute, so it already starts to decrease, right? So if it's above 50 in that age group, it's a warning sign. If the child is between 1 and about 4 years old, around 40, up to 40 breaths per minute, right? It keeps decreasing. And after that, in adolescence and adulthood, it's expected to stay in that range, right? From 12 to 20, 25, right? 12 to 20 breaths per minute, okay? So let's pay attention to the sign of increased respiratory rate, which is an extremely important sign for identifying respiratory conditions, especially in childhood, okay? So respiratory rate, respiratory distress can also be identified by the difficulty in inhaling. You notice that the child starts to exert effort, the muscles become visible, and the child strains to inhale, right? This means that air is having difficulty entering the lungs, that the normal way of breathing is inefficient, so the child needs to use more effort. So they start to use these muscles here, which we call accessory muscles. These aren't necessarily muscles meant for breathing, but they are used when someone is having difficulty. So that's a warning sign, right? Respiratory distress, straining to inhale, okay? And another sign we can identify is nasal flaring, right? So the nostrils here start to open and close because the child is making a great effort to breathe. This area needs to open and close so they can breathe better. So that's another sign of respiratory distress, something you should definitely watch for. So increased respiratory rate, discomfort, greater muscular effort to draw in air, and nasal flaring are 3 signs we need to identify. So if the child has a fever, is experiencing respiratory distress, has an increased respiratory rate, and has a productive cough, this child should definitely be taken to a healthcare facility, no doubt about it. Okay, so let's pay close attention to these signs, because if we can identify them early, the prognosis is always better. Okay, and the last sign we can identify, the last symptom, which often goes unnoticed. Sometimes the child may actually become even more whiny than usual, right? And they may just moan for more reasons than they typically would. So when you handle them, they just keep on moaning. If they're lying down, they're still moaning. Whether they're eating or not eating, they end up moaning anyway. So if the child is moaning more than usual for their age, especially if they don't speak yet, then moaning is a sign that can indicate the child is experiencing some discomfort, and it could be of respiratory origin, especially if it's accompanied by the symptoms we mentioned earlier, okay? So let's keep an eye on these children. Let's take care of them as much as possible so that pneumonia doesn't develop, right? So that we can monitor them and ensure their development is the best it can be, okay? I hope this was helpful. Share this video with anyone you think needs to see it. Since we know that many people, right, need to always be aware of these symptoms, especially in younger children. So hug to you all, and I'll see you in the next videos.